I was actually presenting data from a joint analysis we undertook with a group in the United States called the Health, Aging and Body Composition Study. And we were looking at how much the peak value that you achieve during midlife for muscle mass, muscle strength and physical performance influences the point in later life when you're much older and those indices have begun to decline. And rather interestingly, we discovered that around 50% of the body composition values were maintained from midlife to later life, whereas about 70% of grip strength and physical performance, for example gait speed, was determined by the loss rate because of environmental influences during later life. So that your body composition is contributed to by your genes, your childhood environment and your environment during young adult life, whereas the rate at which you lose muscle strength and impair your physical performance is contributed to rather more by accruing comorbidities in later life. In the analysis that we were undertaking, we started off in an assembly of cohorts in the UK that actually measured grip strength throughout the life course. In the analyses based on the Health ABC cohort, we had to start at age 70, which was the earliest at which those individuals were studied. Amalgamating all of the data together, though, it's quite clear that we should be devoting some of our efforts to the accruing of peak muscle function, as well as retarding the loss of muscle function with advancing age into our later decades. We should be starting early and should focus on both the growth phase, maximizing the peak that's attained in the second and third decades of life, maintaining that peak during mid-adult life, and only then focusing on efforts to retard the loss from that peak during involution. The most important of these is resistance physical activity, so aerobic and resistance training should certainly commence during childhood and continue through adult life to later years. That's not to say there isn't a dividend to be gained even in the very eldest elderly, but to maximize the preventive approach against sarcopenia, we'd want to start early. And we know that not just body composition and muscle performance track, we also know that behaviors track, so that if we can instate healthy behavior patterns, both physical activity and nutritional, during earlier years, they're likely to have even greater dividends as we get into our later life. I think that if you miss that earlier phase, you've still got the later phase in which to reduce the loss rate, but you're condemned to doing so from a worse peak, if you like, than had you optimized that during midlife. I think that there have been profound changes in our approach to physical activity over the last 5 to 10 years. You are absolutely right that we've focused our energy on nutrition, avoidance of tobacco and avoidance of very heavy alcohol consumption. But there is a growing understanding that maintenance of physical activity, and particularly of physical activity that loads the muscles, is going to be an important contributor to reducing physical disability in our advancing years. In the United Kingdom, a GP can actually prescribe an exercise class to an older person. Not all of our areas have access to those, but many of them have them as part of their falls and fractures prevention schemes, and they're often self-help groups that are peer-led and that do step or various types of endurance muscle activities. They're not necessarily fully endurance training levels of activity that need to be supervised by physiotherapists, but they're certainly of substantial benefit, both from the point of view of muscle function, prevention of sarcopenia and falls, and indeed general well-being.